It is now a global health emergency, according to the World Health Organization. With us now on how well prepared we are to confront 2019-nCoV, or the coronavirus, Dr. Eileen de Villa, Medical Officer of Health for the City of Toronto, the largest local public health agency in Canada. And Dr. Michael Gardam is Chief of Staff and an infectious disease specialist at Humber River Hospital. Thank you both for coming here. I know it's been a very busy week for both of you. So we've had experience with SARS. What makes this coronavirus unique? Dr. Gardam.
There's a number of things. I think one is the virus itself. So we know right out of the gate that this virus is less deadly than SARS, so that's good to know. And, you know, while there is growing evidence that it may be a little bit more transmissible than probably SARS was, we also know that it clearly is not as transmissible as, for example, influenza is.
Well, how does one person get it? How do you transfer it?
Basically, it's typically close contact. So if I have the virus and I'm coughing on Eileen, I'm coughing on you, there's a good chance those particles coming out of my mouth might hit your face, and then you could get infected that way. That's typically how these things are spread.
Mm-hmm. Well, we've now surpassed the 10,000 mark in the number of coronavirus infections, and there are deaths in the hundreds. Let's look at how the virus has spread. We have a graph there. And Eileen, what does this rapid growth in new cases, virtually in 1 month, tell you about this coronavirus?
Well, I think it's important to notice that, yes, you have the numbers there, but you'll notice that the vast majority of cases are actually in China. And when you look at the graph very carefully, you'll see that, in fact, there's been very little importation or exportation to other countries. And in fact, the growth in that curve is not being seen.
How important is that to convey that information?
It's extremely important because it's important to understand the context and for people in our community here at this time to recognize that, you know, the risk remains extremely low in our community.
Michael, we've heard reports from non-government sources saying that the outbreak is even far worse than the numbers that we're seeing. How accurate are those reports?
You know, I look at it the opposite. I say, in fact, there's likely that we have many-fold more people who are infected with the virus who aren't actually sick with it, or minimally sick with it. And I actually...
In China?
Yes, in China. And I actually think that's a good news story, because what it's telling us is that mortality rate of 2% might be 0.2 or even 0.02%. And when you start getting into such a low mortality rate, you're looking at something more akin to seasonal influenza, which we deal with every year, than something serious like SARS. So yes, the virus may very well have spread further, but as we get more information, it actually makes it less serious in terms of people getting sick with it.
I know you're both medical in the medical field, but there seems to be a political undertone to this. Is that a fair statement to make?
Every outbreak I've ever dealt with, there's always a political undertone, right? And so even, you know, the WHO is one of the most political organizations on the planet. So when it's making recommendations or it's declaring something a public health emergency, there's always political repercussions from that, right? If a country decides to ban travel or something like that, it may be partially due to the virus. There may be other political, economic reasons why they're doing it. So governments use things like this for various advantages, and so it's never just about the disease control.
Do you think that, oh, sorry, go ahead.
And I think that, you know, when we're talking about a situation that involves multiple countries, you can't help but get into some degree of politics. So I think that's just part and parcel. And certainly public health containment measures often step into the realm of controlling movement of goods, movement of people, and that inevitably has a political aspect to it.
Well, when you're talking about movement, we do live in a digital era, and movement of information or movement of conspiracy theories. How difficult is that for you to get the correct message out when we have people on social media saying the opposite?
Well, I think you're quite right. With social media platforms available and in wide-scale use globally, there is the potential for misinformation, and in fact, we're seeing quite a bit of misinformation out there. As Michael rightfully pointed out, we're dealing with a new virus, a new infectious disease, and I think that new emerging infectious diseases, new health risks, tend to generate more fear and anxiety than the standards like influenza, as Michael was talking about. We know that influenza has a health risk associated with it, but most people don't think about that.
Because it's something that's been around for a
A
while.
long time, right? We're used to seeing it every
And you know
year.
the
It's
outcome.
a familiar thing to most people because we've known about it for quite some time. That doesn't actually take away
The
from the
seriousness.
fact that it is quite serious and has significant health impacts. But the new risks tend to get more attention. I think you get more fear and anxiety associated with that as a result, and therefore misinformation. That's why it's beholden on us, local public health authorities, provincial, federal, et cetera, and in concert with our clinical partners to make sure that we're putting out credible information. And I'm urging people to absolutely get updates, inform yourself. That's all perfectly appropriate. But when you're doing that, go to the credible sources of information. Go to, reliable sources. Don't just go to any, social media channel or trust what, frankly, non-health authorities are saying, because there is a lot of misinformation out there.
Do we understand yet when people are contagious, Eileen?
Well, I think that's still, we're talking about a new virus. So still trying to understand this virus in its, in all its aspects. But we certainly talked about, and Michael indicated, that people who have symptoms are better at putting out the particles, the virus particles out there. So certainly being symptomatic would be one of the risk factors.
Yeah, I would agree. I think that, we do know a fair bit about other respiratory viruses, and there's no reason to suspect that this would be fundamentally different. There's sort of the laws of biology going on here. And we know with influenza, for example, that when people are infected, for the first 12 hours or so before they develop symptoms, they have a small amount of virus in their nose. But when they start to develop symptoms, they can have 10,000 more fold virus that they're spreading, and they have symptoms that are spreading it, and that can go on for 5 days. So while a little bit of virus in your nose could theoretically make you contagious, the relative contribution of people who are walking around feeling fine, shedding a little bit of virus, has to pale in comparison to the people who are actually sick and who are coughing on others.
I want to talk about where the virus originated, and we've heard of there was a live animal market in Wuhan, China, and that's deemed to be the epicenter. Do we know which animal is the source, Eileen?
Well, I believe that's still very much the subject of investigation and further study. I think what's good about these kinds of things is that we are seeing a lot of international collaboration and cooperation so that we can advance the science on this.
And Michael, what happened in that market that resulted in this new virus?
Well, it's been known for a long time that when you have a really dense congregation of people and animals in one area, that's the best situation to have, viruses or pathogens jumping from animals to humans. And a lot of human pathogens came from animals, and coronaviruses are animal viruses. They're well known in bats, for example, where SARS likely came from. This may have come from bats. That's the latest, although they were also talking about snakes the other day.
That's right.
Do you need to know which animal it came from in order to get a vaccine or to get a...
No, that doesn't impact anything. Okay. It's really just the sort of understanding the epidemiology. So once you have those animals and humans in close contact, it's just a matter of kind of probabilities. At what point, what event, people, how close were they, et cetera, and then it could potentially jump into human populations. You also need typically some mutations in the virus that are just hanging out and just by happenstance happen to jump into a human, and then it can start to propagate.
Oh, yeah.
So, and I was saying that, I'm thinking that while the epidemiology is interesting and, to know, and that's why it's helpful to do these studies, perhaps from a public health perspective, it's also helpful to understand source so that we can think about preventative strategies for future.
How prepared are we as a country to deal with the coronavirus?
Well, I think that here in Ontario in particular,
because
given
of the
our
SARS
experiences with SARS, there were many lessons learned. Certainly Michael and I can comment on those for an extended period of time, but suffice it to say that there were many, many lessons learned, and many of those lessons have been put into practice on an ongoing basis, and certainly in respect of responding to this situation that we're in right now.
Michael, what were those lessons?
Oh, there were many of them, but I mean, just thinking back to SARS, right? At that time in 2003, public health didn't have a way of really easily communicating with clinicians, and so you'd hear about it because you knew somebody, not because there was a way of doing that. We were not adequately screening for people who had fever and cough. We weren't necessarily isolating them. Our staff were not trained to wear the appropriate personal protective equipment. We didn't necessarily have stockpiles of it. We can go on and on and on. And so the measures that we took during SARS, those aren't normal measures. Those were measures because we were afraid this was getting away on us, and we were doing whatever it took to try to control it, not dissimilar to what China is doing now, but on a much smaller scale. We learned all those lessons, and so now we have the equipment. People have been appropriately trained. There's nothing. I keep getting asked, what are you doing differently today? And the answer is not a whole lot. We've been doing this for the last decade.
Well, your hospital was built after the SARS outbreak. What do you have that makes you more equipped to deal with cases like this?
Well, I think fundamentally the older hospitals that we have in Ontario and other parts of Canada, I mean, I often sort of bleakly joke that they're kind of designed to spread infectious diseases. We have people in 4-bedded rooms. They don't necessarily have the greatest ventilation. They're crowded. There's not enough space to store things. And so newer hospitals, when they're built, we're typically taking into account all those things. And so we have a lot more single rooms. New hospitals in Ontario have to have at least 80% single rooms. We need more negative pressure rooms. We have place to store things. And so walking the corridors of Humber River versus other hospitals where I've worked, it's actually shocking the difference in terms of how much space you have. But Humber took it further than that because Humber was being designed at the time SARS was occurring. And so we actually have special ventilation systems. We actually have 100% fresh air ventilation, so the air is not being recirculated in the building. We can control different buildings and different wings with ventilation. It's really quite remarkable how it was built.
You wanted to say something?
Yeah, and I think that, over and above those improvements that we've seen in the hospital settings, we have better laboratories. Yeah. We have an agency, Public Health Ontario, specifically set up to help provide guidance and science to public health practitioners and to healthcare practitioners. We have better communications existing between the various players at the local level, at the provincial level, and at the federal level, and between public health practitioners and healthcare practitioners. We have more robust information systems to support the share of information between the various players that are engaged in the response. So there really has been quite a bit of work here. And as Michael rightfully points out, these are systems that are actively in play on a daily basis, including infection prevention and control standards. Here in the City of Toronto, we established a group within Toronto Public Health called the Communicable Disease Liaison Unit. So we are in active conversation on a daily basis with hospitals here in our city on all matters that have to do with infection prevention and control. Well, these are major improvements relative to what existed back in 2003.
Michael, but China was also the epicenter for SARS, and cases are soaring there again. Why isn't there the knowledge and preparation we have in Canada?
I wouldn't say there isn't the knowledge. I think that if you look at even the pictures coming out of social media, it's not that people don't have personal protective equipment. They may be running out of it, but they're following the same practices that we'd be following here. I think one thing it's important to remind people of is you always identify outbreaks in hindsight, right? The first case of something, you never identify it. And imagine, respiratory outbreak in a crowded market in China during flu season. That probably happens all the time, right? So you're trying to sort through all the noise to actually discover something new. And then by the time that this was identified, which wasn't that long, very soon after we had the virus identified, we already had a test for it.
That's right.
And, China's actually been doing very similar things to what we did during SARS in terms of their control measures. It's just tricky when you're the first place that has something.
And it's also during flu season.
It's during flu season, and these things tend to get away on you until you recognize them, and then you start your control measures.
Eileen, before the news of the new coronavirus broke, we were dealing with a really nasty flu season. How is the flu presenting in Canada this winter?
So we are having a busy flu season, you're quite right, in Canada. And when I look at our data, our most current available data in Toronto, In terms of lab-confirmed cases, we are definitely higher than we have been in the previous seasons. So we are having a busy flu season. Hence, we're reminding people that, look, it is cold and flu season. Please continue to practice those good hygiene practices that we tell people every single season.
Is there a concern that because, what happened in China, it's happening during the flu season, that even here, we're having a flu season, that someone might present with the flu, but it's actually like the coronavirus?
Well, as it turns out, when you look at what makes good sense in terms of good infection prevention and control practice at an individual level, what makes sense to prevent cold and flu makes sense to prevent all respiratory viruses. Washing your hands with soap and water on a regular basis, trying to avoid touching your face. And that sounds so simplistic, but people touch their faces a lot without even realizing it.
I have to admit that in other flu seasons, I wasn't really paying attention at how much I touched my face. And now I am paying a lot more, and I'm always touching my face for some reason.
So if that's one of the things that emerges from this particular situation, that may not be the worst thing in the world, to actually have people recognize that there are some very simple measures that they can do to protect themselves at all times. Hand washing, covering their cough, and getting an annual flu shot. These are all very good things to be doing.
I know this is a serious conversation, but I have a little bit of a laugh. But it does have something to do with coronavirus. This is from the satirical news website, The Beaverton, and they wrote, public health officials in Toronto have confirmed its first 50,000 cases of being a misinformed blank as xenophobic conspiracy theories and tales of false cures continue to spread across social media. Becoming a complete moron during an infectious disease outbreak is far more viral than we first thought, said Dr. Janine Smith of Toronto Public Health. Fact resistance is abnormally high. Patients are usually asymptomatic until they open their mouths or start tweeting. I know that is funny, but as the first global health emergency in the age of social media, the coronavirus, how do you deal with that in public health, Eileen?
Well, I think we deal with it best by making sure we're putting out information on a regular basis and trying to communicate as clearly as possible with our population and help them put risks in context. Also giving people information around what they can do, what actions they can take to protect themselves are fundamental. So I can't say it enough. Wash your hands, right? All those good pieces of advice. Wash your hands, cover your cough, don't touch your face, or at least try to avoid doing so. And please, get your flu vaccine every year, right? I don't think we can say that enough.
Yeah.
A lot of Asian Canadians have been sharing stories of people saying racist things or avoiding them. The same thing happened to the Chinese Canadian community during SARS.
Yep.
So, not that it needs to be done, but maybe this is an opportunity to do this. Let's quell those notions. Is there any higher risk in the Chinese Canadian community than elsewhere?
This has nothing to do with what ethnicity you are. It has to be where you've been, right? And right now, if you look at the epidemiology, as I've been saying, this is China's problem right now. This is a problem within the borders of China, and we don't want it to become the world's problem. This is not about people who live here in Chinatown or people who live elsewhere in the city. This has nothing to do with that.
Because this is going to be, it's having real life repercussions beyond the health of Torontonians, right?
And I think, to add further to that, as much as people think they're trying to protect themselves, protect their health, and protect the health of others, it's actually not helpful, right? What is helpful is going to credible sources of information and, informing yourself that way. And that's what we're trying to do, is to make sure that the right sources of information, that facts are getting out there, not misinformation.
What about masks? I've seen a lot of people in public transit with masks. Do they help?
No. The thing with masks is that there's really and masks have been studied, believe me. And there is no good evidence at all that walking around downtown wearing a mask does anything for you. In fact, given the close nature of contact you need for transmission, it actually doesn't make sense why it would work for you. So wearing a mask around is not helpful. The only time where a mask has actually been shown to be helpful is that if I'm sick and I have to come to a meeting with you, my wearing a mask will help prevent you catching it from me. So the only people right now who should be wearing masks are healthcare providers who are in the direct line of fire caring for patients who actually have these symptoms. Wearing them in the general public is not helpful.
Right, and if I can with that, as much as Michael was offering to protect you, at this hypothetical meeting by wearing a mask, frankly, from a public health perspective, even better is if he's sick, he should stay home.
But that's great advice. But most businesses, they expect people to come to work, or you have X amount of sick days, right?
Yeah, and I can appreciate that. But I think at this stage of the game, truly, where possible, if you're ill, the best advice that we can offer in terms of preventing the spread of disease, whether we're talking about influenza or any other respiratory virus, best advice, stay home if you're sick.
And we've been giving that advice for the last 17 years. That actually hasn't changed.
That has not changed.
It does seem like the temperature is a bit higher. I was sharing with you that I take public transit, and even for me, as a rational, I think I'm a rational person. When I did hear someone cough, I was like a bit on alert. How do you convey this information to people who are scared about something that is new, without patronizing them, by trying to understand maybe where that fear is coming from?
I think setting ourselves as an example. I mean, I take public transit all the time. I take the streetcar, I take the subway. I'm not wandering around the city wearing a mask. I was joking yesterday, if you see me walking around in a hazmat suit, then we should worry. But right now, I'm not doing any of that, and none of us are. Right, and so I think leading by example, saying that we're not doing that, and it just doesn't make good scientific sense why you would worry about that. And your comment about riding the subway, right? People cough on the subway all the time, and I can assure you, before we heard about this coronavirus, people were coughing even more on the subway because our peak of flu was actually between Christmas and New Year's. But nobody noticed it, and they're noticing it now because of the heightened fear of the coronavirus. But those people coughing, they don't have the coronavirus.
So I hope when you see us on the subway, what you will see us doing is appropriately covering our cough and sneeze and using alcohol, hand sanitizer. That's the kind of behavior you will be seeing from people like us.
So researchers are working around the clock, I imagine, in labs worldwide, trying to work on this new virus. What are they looking for?
Well, there's a couple things, right? So, I mean, first of all, they want to get a sense of how similar is this virus to other coronaviruses? What are the factors in this virus that are actually causing illness in people? And then obviously they want to look at things like, are there parts of the virus that would be very good targets for a vaccine? Lots of media reports in the last 48 hours about the world rushing to get a vaccine. You might be able to come up with a reasonable molecule that would be a good vaccine, but that doesn't mean you can just go give it to people. It has to go through multiple trials, and realistically, we're looking at a year plus before something would be available. And of course, we don't know a year from now whether this is going to be a flash in the pan like SARS was, or an intermittent thing like MERS was. We don't even know a year from now if we're going to need a vaccine. And so lots of excitement about vaccines, but I'm not sure that's really something we should be hanging our hat on right now.
Eileen?
Yeah, I would agree. It does take quite a bit of time to develop a vaccine, and there would need to be some testing associated with that.
You'd have to know if it worked.
Right? You would have to, you'd have to know that it works, and you'd have to know that it was, appropriate for use. And there's a lot of steps before you get to a vaccine that's ready for prime time.
Well, we thank you so much for your time. I know it's been a very busy week, and we appreciate the information that you've shared with us today. Thank you very much.
Thanks for having us.
That was Dr. Eileen de Villa, Medical Officer of Health for the City of Toronto, and Dr. Michael Gardam, Humber River Hospital's Chief of Staff. Thank you so much.
Thanks.
Thank you.
The Agenda with Steve Paikin is brought to you by the Chartered Professional Accountants of Ontario. CPA Ontario is a regulator, an educator, a thought leader, and an advocate. We protect the public. We advance our profession. We guide our CPAs. We are CPA Ontario. And by viewers like you. Thank you.